Welcome to Health Organizers, your digestive system specialist. In our Health Bites, we strive to provide you with just enough information to chew on so that you can understand how to care for your digestive system, also known as your hole in the middle. On this edition of Health Bite, we will be discussing hernias, hiatal hernias and inguinal hernias. Now, a hiatal hernia is one that occurs in the stomach. First of all, a hernia is basically just when one organ moves through an area to another region other than where it's supposed to be. So in a hiatal hernia, we have a part of the stomach moving up through the diaphragm, which is the major muscle that's involved in breathing. And so as far as the risk factors for that, it could be trauma. Maybe you've taken a hit to that area and damaged the diaphragm so that the stomach is able to slip through. It could have been perhaps just a congenital or a condition that you're born with that makes your diaphragm not as well formed as it needs to be and allow that stomach to kind of slip through. So as far as the symptoms go, well, you may have difficulty breathing, you may have difficulty swallowing, you may have pain in the region. That would occur with your hiatal hernia. As far as natural treatments go, there are different maneuvers that we can do in using physical medicine, for example, and other things, and perhaps surgery may even be necessary depending on your certain condition. So you would definitely want to contact us to see what might be recommended for your individual situation. As far as an inguinal hernia goes, that again, remembering that a hernia is just a movement of that organ into another region, the small intestines this time are moving down into an area where they typically should not be. Very often it's into the groin region. And so again, risk factors for that may be heavy lifting, or again, just malformations of different tissues, even just from birth, that make those areas kind of weak, traumas to the area, that kind of thing. So symptoms would be pain in the groin, maybe pain sitting down, positional changes, etc. So again, as far as therapies and how natural medicine could help with an inguinal hernia will depend on what the exact cause was. That concludes this edition of Health Bite on hernias, hiatal hernias, and inguinal hernias. Be sure to look for us on the web, healthorganizers.net. Like us on Facebook, follow us on Twitter. I'm Dr. Megan Laban, and remember, Health Organizers, working with you to tidy up your health naturally.